It might be your first day, July 1, and you sign up for somebody who's really sick. You're encouraged to go in that room to be their provider, but you have that backup, you have the support.
In the ER, you're first in line for the procedures for your patient. And I had a good set of seniors when I was an intern, and they would pull me out to do procedures on patients that I really wasn't even seeing primarily. So it is a great experience.
There's always going to be something in medicine that you haven't seen or presents a little differently, and just being able to think on your feet enough to be able to deal with it is a big part of how this residency is.
We serve a catchment area of about 1 million people in Western Maryland, North Central West Virginia, Southwestern Pennsylvania, and Eastern Ohio. The opportunities for learning are incredible.
One of the first parts of our mission as a resident here is to make you a really outstanding doctor. When you come into our program, you don't have to have 5 or 10-year life plans of what you think you want to do in the specialty. It's awesome if you do, and we'll help you chase those plans.
Our residency leadership team is amazing. They will go above and beyond to ensure the health and wellness of the residents so that they can be the best young physicians they could possibly be.
We run SIM at least once a month, if not more. They definitely help in seeing cases that we maybe don't see as frequently here.
It's always a senior and an intern that goes in. The intern will basically take the case as far as they can, and the senior just kind of is there to support them. Doing the sim itself, it will point out to you what you do and don't know, and then afterwards we always do a really good debrief.
At Ruby, we work in this big tertiary care center. We have everything we need at our disposal. I can call whoever I want to come down and help me if I need to. But we also rotate a lot at UHC, our community site, where you don't have all of those resources, and you have to learn how to manage patients on your own, transfer them out, and make good decisions in that setting. Even further, we have the REMI program, which is a rural program where we visit these very small hospitals throughout the state where you really don't have the resources. You might have a few beds and a couple pints of blood or whatever you need, but you do not have the same things that you have at these big sites. So it's a good mix of trying to figure out if you want to work in that environment versus the academic setting.
We like it here very much. Our daughter's school age, all of her little friends that we've met are very fun. Our son is 1.5 years old, and we meet a lot of families with young kids here, and we like it.
There's so many things to do in West Virginia. I'm never bored. Hiking, I'm a big hiker. You can hike anywhere here. I also like that if you don't like to be outside, there's still things inside to do. We have Broadway shows that come into town that you can see. You have the rec center here.
I would definitely say this is a family type setting where they're comfortable with you coming to them with any problems, whether it's related to the residency, other rotations that you're on, or even personal problems, because they want to make sure that your whole experience here is going smoothly.
It is not malignant at all. If there's something you don't know or there's something you don't know how to do, they just teach you how to do it. And it just makes it very easy and open, and you don't have to feel nervous.
You're not going to find closer residents. You're not going to find residents who feel so comfortable with faculty that they're not afraid to ask questions, they're not afraid to learn.